For those of you who don't know me, my name's Angie Brill. I'm the clinical director over at Dankmeyer. And Lori asked me to come over to be able to talk with you about something that we've provided recently that one of your patients has, which is what we call an RRD. It's a rigid removable dressing. This is just one type. There are many different types of them out there, but it sounds like this is probably what shock trauma is going to start using. So this is the one that I brought over, and this is the one that your patient here has, to be able to show you how it works and how to put it on, take it off, and have just kind of a general protocol for how to use it. So it's fairly simple. This is, they call this one the softy type because it's a type of rigid removable dressing, but it does have a lot of flexibility to it. It's a firm pad is what it is. So it has a nice structure that'll provide compression of the residual limb and protection of the limb, but it's not a rigid structure. It doesn't have any plastic reinforcements. There are some out there that do. You may eventually see one that comes through that does. And if that's the case, if we end up providing one, I can always come back and do an in-service on that particular one. But I figured we'd start with this one today since this is the one you have here. So it's, a lot of this is just Velcroed on and stuff comes apart. So the basic stuff that you want to know is this is kind of essentially the bucket that goes on the limb. It's universal, right or left, so just depending on which way you flip it. The lower side goes medially for the groin area. So in this case, our mannequin is a left transfemoral, and this would have already been fit. So there's some padding that's inside as well, and that would have already been put in there based on the length of the residual limb. And then what all you're gonna do is you can take this piece off, this piece off, this closure piece off if it's easier to kind of get it on. So I would leave the distal cap on there. Go ahead and you'll put a sock on first, and any dressings that were on there. And then you can go ahead and pull it up as high as it'll go.
The sock's going to come with them?
Yes, the sock will come with it. And it would have been fit with the sock over at Shock Trauma.
Will we have extra in case they get drainage on it? Or?
We can always order some for you. They will get 2 socks to start.
Okay.
But if you have any issues,
Are they washable?
They are washable.
Okay.
Yes.
So hand washable,
Yes.
right?
You could throw them in the laundry here. It wouldn't be a problem.
No drying.
They are able to be dried in the dryer.
Okay.
So you can throw it in the washer and the dryer here. Hand washing is fine too. They're a thick enough sock that they'll hold up against the washer and the dryer. But if you do need any extras, you can always give us a call and we can get some.
You didn't bring one with you, did you?
I did not. You know, and I forgot to bring.
Want me to grab it from the room?
No, that's okay.
She's talking about extras.
No, so you can see what the socks
Just to
look
see
like.
what it. Do you want to see what it looks like? Is that?
I'll grab it.
Is it like any shrinker or is it?
The nurses will let us.
Yeah, perfect. Then we'll go grab them.
Okay.
So what you can do, you can actually leave this on. Leave this. This is the neoprene closure. You can leave it on attached to the back. Slide this on, and then all you're gonna do is you want it just snug. And there's going to be a piece that comes up the side here, and this is where the belt attaches. Again, everything's just Velcroed on. And there'll be another little piece for the Velcro. You can decide, you can move this around. It's double stick Velcro, so you can move it up higher or lower, depending. Perfect. And then just wrap it around, and this just helps to keep it suspended so that as they're up and moving around a little bit, it's not going to be falling off. And you can make the belt tighter just by moving the Velcro around. You know, if you need to snug it up, you can do that too. So in terms of the sock, thanks so much.
Oh, you're welcome.
and then you can just kind of leave it all together to take it off if you're going to change the dressing. So the sock, this is just a normal prosthetic sock that is given to a patient. These are similar to what you would see on an amputee who's actually using a prosthesis. And all you're going to do is just roll it on over top.
Does it have seams?
It does not have seams.
Not anymore.
No,
The outside.
no, they don't have.
The inside there.
So I thought the seam always went on the outside.
So there's not actually there's not like a I mean, you can see where it's together, but it's not like
It's
not like the old ones that we used to have that had like a ridge on it.
yeah, it's not like a ridge,
Side.
right? Correct.
The distal end is slitted also?
It is. Yeah, there's not a wrong way
Or a right.
or a right way to put it on. Sometimes it's easier if you have an extra set of hands, though, especially if they have any sort of tenderness at the distal end from the incision. So sometimes, if you got an extra set of hands to help, just stretch it, just so when you put it on, you're not just pulling. But leave the dressings on, whatever dressings on, first, and then the sock goes over top.
Now, if this was a female patient, would you recommend they take it off for toileting?
That would probably be the
I'm just
easiest.
seeing a lot of issues.
That sounds like a really good idea.
Would you recommend trying to put it on prone? That's what I've tried. I mean, not prone, supine, ideally.
Supine's probably the easiest.
Okay.
They can do it in sitting, which is not a problem.
Right.
So, supine or sitting is perfectly fine.
Do you use the belt if you have a BK also?
Yes, there is a belt for the BK as well.
And it goes around the waist also.
And it goes around the waist. Correct. Correct. It's just a longer extension. The BK one, sometimes it'll come with a reinforcement in the posterior to help with the extension as well. And I've got a couple things to leave here for you. It's just, there's a picture of the transfemoral one and the transtibial one and the protocols that are recommended for each of them, so that you guys have.
And just to reiterate, they're allowed to come off for exercise, for
Correct.
bathing, for dressing.
Yes, yes, and they should be taken off for those things.
So on the vast majority of the time, but off for those
Yeah.
types of
Yeah,
activities.
offer any sort of activities that you think they should come off for. For instance, the PT can decide if they're going to leave it on based on what they're doing, or if they're going to take it off based on what they're doing. But otherwise, keeping it on.
But they still should be having
23/7.
normal wound care, normal bathing.
Normal wound care, normal bathing, take it off. It's a rigid removable dressing, so feel free to remove it
Yeah.
to do things.
What I saw online was, I might have missed this part, so
Yeah,
twice
you're
a
good.
day, morning, afternoon,
Yeah.
for skin checks, 15 to 20 minutes, I think I saw.
Yeah, that's their recommended protocol, but if you need to take it off more to be able to do bathing or therapy or anything like that, that's perfectly fine.
Okay.
But they do recommend to take it off, at least once or twice a day, just to check the skin to make sure.
And for those who haven't seen it, you might want to
You'd be
feel the
doing that.
bottom, because it really does protect the end of the limb before it falls or bumping and things like that,
Yeah.
so.
So you've got a nice cushion there at the bottom here because you've got the pads in there. And again, this is the kind of the softy version, so it doesn't have any sort of rigid reinforcement, but it's going to provide a lot more protection than just the dressing.
When you have it for a BKA, does it actually immobilize the knee pretty well?
You can do it with the posterior reinforcement that, yes, would immobilize the knee. I can show you. So for the BK one, you can have that extension that helps to immobilize.
We would probably want that.
And I would think most people, but it's one of those things that could come off too.
So what is
So,
this made of, this
It's a plastic.
posterior, so it's a plastic splint essentially?
Yeah.
Okay. Thank you.
And just to be clear, this is to replace the ace wrapping that we've been doing previously. We do not need to ace wrap anymore.
You don't have to ace wrap in addition to it.
Okay.
If for some reason the physician is recommending ace wrapping, maybe to help additional edema control, that's perfectly fine. It's not going to hurt it to ace wrap underneath. Like if you would do the sock and then ace wrap around the sock, you can, but it's not needed.